Did you know nearly 4% of hospital patients in New York in 1984 experienced disabling injuries from their treatment?
Whoa, that's a lot. Was it mostly due to bad luck, or was there actual negligence involved?
That's the kicker. 28% of those adverse events were due to negligence. And some types of errors were more likely than others to be negligent.
Let me guess. Misdiagnosis.
Exactly. Diagnostic mishaps had a negligence rate of 75%, and therapeutic errors, like noninvasive treatment failures, were at 77%. That's huge.
Okay, so what's the most common kind of harm? Is it all surgeries gone wrong?
Not quite. The most common single type was drug complications, 19% of all adverse events. But if you zoom out, almost half of all adverse events were surgery-related.
Interesting. But are these drug complications mostly unpredictable allergic reactions?
Some were, like unexpected allergies, but others were straight-up preventable, like bleeding from mismanaged anticoagulants or marrow suppression from chemo without proper monitoring.
Yikes. So who's most at risk here?
Elderly patients. People over 64 had more than twice the rate of adverse events and negligence-related cases compared to those under 45.
That's probably because they go through more interventions, right?
Exactly. Plus, they're more vulnerable to falls, non-invasive mishaps, and complications from coexisting conditions like heart disease or diabetes.
Let me ask, where in the hospital do these events usually happen?
Believe it or not, 41% of them came from the operating room. But the highest negligence rates were in the emergency room, 70%.
70? That's wild. Why?
Likely due to understaffing, overwork, and maybe less experienced doctors on shift. Time pressure doesn't help either.
Okay, I gotta ask. What kind of errors are we talking about? Slips during surgery?
Actually, the most frequent were errors in performance, like procedural mistakes. But the ones most likely to be negligent were diagnostic and prevention errors.
So forgetting to order a test could be more legally damning than cutting too deep during surgery?
Weirdly, yes. Errors of omission, like failing to act on test results, were often considered more negligent than hands-on mistakes.
Sounds like not doing something can be worse than doing it badly.
Exactly. And the more severe the negligence, the worse the outcome. In cases of grave negligence, nearly 75% of patients had serious disabilities, and 2/3 died.
That's chilling. So, can these events be prevented?
Some can't, like allergic reactions you can't foresee, but many can. Improving systems, education, even automation could cut down error.
Like alerting doctors if a drug order clashes with known allergies?
Yes, a kind of fail-safe system. Also, clearer practice guidelines and better training could go a long way.
I feel like we need to move from blaming individuals to fixing broken systems.
That's the big idea. Medicine needs to learn from aviation and nuclear power. Treat safety as a science, not just common sense.
So if we could map these risks like flight paths, maybe we could dodge a few crashes.
Beautifully put. The future of safer healthcare isn't just more knowledge. It's smarter systems and fewer silent failures.